Hi, my name's Madison. I'm a nursing student and I'm going to be completing a focused assessment on you today. I'm going to be assessing your airway, breathing, and your circulation. I'm just going to compare with your hospital band your name and date of birth.
Grace McDonald, January 28th, 2001.
Okay, amazing. And do you consent to this assessment and to me recording this assessment?
Yes.
Okay. To start, I'm just going to ask you a few questions. What brought you in today?
I'm experiencing chest pain, shortness of breath, and excessive coughing recently.
Okay. The shortness of breath, how long has that been going on?
It's been going on for a couple weeks on and off.
Okay. So it's intermittent, like it's not constant. Okay.
Yeah, but the last week it's been pretty constant.
Okay. And do you notice anything that makes it worse or better?
Not necessarily. Like when I'm resting, it's better, but I don't really have a lifestyle where I can just rest all the time. So
Okay.
I'm here.
Okay. What do you do for work? Do you think that's contributing to the shortness of breath?
I teach Pilates.
Oh, okay.
So it could be.
Yeah. Okay. On a scale of 1 to 10, right now, how short of breath are you? 10 being the worst.
Like 3.
Okay. And your cough, is it productive? Are you producing any sputum?
Yeah, not all the time, but I do sometimes.
Okay. Is that sputum thick or thin?
It's usually thick.
Okay. And what color is it?
Sometimes like a yellowish color.
Okay. And the chest pain, how long has that been going on?
Again, like on and off for like around a month, but the last little bit has been more constant than before.
What type of pain is it? Like a throbbing or a pressure?
It's like a heavy, like there's like a weight on my chest a lot of the time.
Okay. Does it radiate anywhere?
No, not that I've really been able to notice.
Okay. And are you having any right now?
Yeah, again, just feeling of heaviness on my chest.
Okay. Do you have any allergies?
No.
And do you have a past medical history? Do you like asthma, COPD, heart problems at all?
I don't have asthma, but there are a couple people in my family that have it.
Okay. Okay, and I took your vital signs earlier and they were all with normal limits, so that's good. Just assessing you here, I can see you're not in any respiratory distress, it doesn't seem like. You're not using any accessory muscles to breathe, and your respiratory rate is equal and it's non-labored, so that's all good. I'm just gonna palpate your chest to assess for equal chest expansion. So I'm just gonna put my hands on here, take a deep breath in and out. Good, and I'm gonna do the back side too. Deep breath in and out. Perfect. So yeah, your chest expansion is equal. I didn't notice any asymmetry. Do you have any pain or discomfort when I did that at all?
No, just like again, kind of constant feeling of heaviness on my chest.
Okay, perfect. Next, I'm gonna listen to your heart or your lung fields. So I'm just gonna use the diaphragm of my stethoscope. So I'm gonna go from side to side, comparing sides. Every time I move my stethoscope, just take a deep breath in and out for me. So starting nice and high above your clavicle. Good. Down to the second intercostal space. Assessing side to side, comparing your lung fields. Good, and if you can raise your arms, I'll just assess the lateral aspect of your lung fields. Deep breath in. Good. I'm just going to assess your posterior lung field. So if you could just turn and face the wall. And same thing as the front. Avoiding the scapula, just make my way down. Good. So auscultating your lungs, didn't hear any adventitious sounds. There was no crackles, wheezing, or stridor, and your air entry was equal throughout, so that's great. Next, I'm just going to listen to your heart sounds. So I'm going to listen with the diaphragm of my stethoscope, and then I'm going to do it all again with the bell of my stethoscope. But you don't have to worry about taking deep breaths with this one. So I'm just starting on the right side of your second intercostal space. This is your aortic valve. And then moving to the left side intercostal space, second intercostal space, this is your pulmonic area. Moving down to the third intercostal space to Erb's point. Down to the fourth intercostal space, the tricuspid valve. And then to your fifth intercostal space at your mid-clavicular line and moving to the apex of the heart. Good, I'm just going to do that all again. Good. So I was able to hear your S1 and S2 heart sounds, and I didn't hear any extra heart sounds. So that's good, and I didn't hear any murmurs either, so that's awesome. Next, I'll just be assessing your peripheral pulses. So starting with your brachial pulse, I'll assess both to compare and make sure they're equal. Perfect, and then now to your radial pulse, just above your thumb there. Good, and then your popliteal pulses are behind your kneecaps, so I'll just assess those. Perfect, and then just moving on to your dorsal pedius, which is the top of your foot here. And then your posterior tibialis, which is behind your ankle bone here. Perfect. So your pulses are all 3+ bounding, they're all equal. And just assessing your lower extremities here, your skin's a good color, I don't see any edema. Your cap refill is less than 3 seconds, so that's all good. That pretty much sums up my assessment. So your lungs were clear, your heart sounds good. There's no immediate concerns that are sticking out to me. I'm gonna pass along my assessment to the doctor, and he's gonna order some tests. We'll run those and hopefully get to the bottom of your chest pain and shortness of breath. And he'll be in soon to assess you as well. Do you have any questions?
No, that's great. Thank you so much.
Thank you for letting me complete this assessment.